$56.
That's how much America added to Mike Kowalski's pension in January of 2026. $56 a month. For months later, he got a job as a cashier at Walmart. He's 68. 41 years of experience. An electrician from San Antonio, Texas. He calculated everything: tables, calculators, 3 meetings with an advisor. The plan was simple. Retire at the end of 2025, collect Social Security, and travel the country in an RV. Then his first statement for January arrived. In the next 16 minutes, a full breakdown by the numbers. What exactly happened to Mike's increase? Why 2.8% turned into a deficit? And 4 specific steps anyone 35 and older can take right now to avoid ending up in Mike's position in 10, 20, or 30 years. Mike Kowalski, not his real name, he asked to change it. But the story is real, and every number is verifiable. For 41 years, he pulled wires. Residential homes, schools, shopping centers. His salary in recent years, about $68,000. Not bad for San Antonio. His wife Karen, a nurse, retired a year earlier. His retirement account, a 401k, showed $218,000 at the time of retirement. Plus Social Security, roughly $2,000 a month. Karen received $1,700. Together, about $3,700 from the government. Plus planned withdrawals from the 401k. By Mike's calculations, it was enough, even for the RV. Then January 2026 arrived. The Social Security Administration announced the annual cost of living adjustment for 2026. 2.8%. The average increase, $56 a month. Saudze fine. But wait until you see the other side of the equation. That number is 3 times larger. Let's go back a year. December 2025. Mike at the kitchen table with his laptop. On the screen, the calculator on the SSA.gov website. Work history. Earnings over the 35 highest years. Date of birth. The calculator showed about $2,000 a month. $24,000 a year. Karen. Another $20,400. Total from the government, roughly $44,000 a year for the 2 of them. And expenses? Mortgage paid off. Kids grown. Car owned. Mike wrote on a piece of paper. Groceries, utilities, insurance, gas, medications, incidentals. Came out to $3,400 a month. $41,000 a year. The difference, $3,000 for travel, gifts for grandkids, golf on Saturdays. Modest, but enough. He didn't account for 3 things. First, Medicare. Medicare Part B, the health insurance that the government deducts directly from your Social Security check. In 2025, Mike paid $185 a month. Fine. Budgeted for. In November 2025, CMS, the agency that runs Medicare, announced rates for 2026. Part B rose to $202.90, an increase of nearly $18, or almost 10% in a single year. The government's SOLA increase, about 3%. Medicare's increase, almost 10%. See where the money is leaking. Add it up. OLA gave Mike 56. Medicare took 18. That leaves 38. Not 56 anymore. But that's just the beginning. Second, inflation on what Mike actually buys. COLA is calculated using the CPIW index. That's the Consumer Price Index for urban wage earners and clerical workers. Not retirees. The problem, retirees spend differently. More on doctors and medications. Less on gas and gadgets. The Bureau of Labor Statistics publishes an experimental index, CPIE, for the elderly. And it consistently outpaces CPIW. Not by much, but over 20 years, the difference adds up. Third, medications. Karen takes 3 prescriptions. Mike takes 2. The Inflation Reduction Act capped costs for some prescription drugs, and that's a real plus. But 2 of the 5 medications the Kowalskis need weren't covered by the caps. Their prices went up. And so, January 2026, the first full Social Security statement. OLA increase, 56.
Minus Medicare 18.
Minus the increase in groceries Mike buys every week. roughly $45 a month above what he used to pay. Minus the increase in 2 medications, about $35. To be clear, this is Mike's specific situation. Exact numbers vary by state, diet, health. But the direction is the same for millions. The net result? Negative $42 a month. Negative, not positive. The increase didn't just evaporate, turned into a hole. And here's what's truly frightening. This isn't an anomaly. This is the system. According to the Senior Citizens League, the purchasing power of Social Security has dropped by approximately 36% since the year 2000. A retiree's dollar today buys what 64 cents bought 25 years ago. Taking a shorter period since 2010, the loss is about 20%. Remember that number. It'll come back at the end of the video. February 2026. Mike on the back porch. Golf clubs in the corner of the garage. Untouched for 3 weeks now. Membership, $120 a month. The first thing he cut. Karen suggested switching from H-E-B to Aldi. Savings, $60 a month. Good. But not enough. March. Mike applied to Walmart. $14 an hour, 20 hours a week. $1,100 a month before taxes. 41 years as an electrician. And now, welcome to Walmart. Stop. Right here is where this starts to matter for every viewer right now. Because Mike's biggest mistake wasn't Walmart. It happened 5 years before retirement. Mistake 1. Mike started collecting Social Security at 67. That's full retirement age for anyone born in 1960 or later. But full retirement age isn't the optimal age. If Mike had waited until 73 years, his benefit would have increased by 24%. Not 2.8%. 24%. That's roughly $480 a month extra. Every month. For the rest of his life. $2,000 becomes $2,480. The difference over 20 years. More than $115,000. And the annual COLs also get calculated from a higher base. The effect, a snowball. The advisor said, 67 is full retirement age. Take it. He didn't lie. But he didn't show the full picture. Now a nuance. Delaying until 70 isn't for everyone. If your health is poor, if you have zero savings and nothing to live on, waiting 3 years without income is risky. But for Mike, with $218,000 in his 401k, he had the option to live off withdrawals for 3 years and then receive a benefit 24% higher. Forever. The exact calculation depends on the situation. A conversation with a certified financial planner here isn't a luxury. It's a necessity. Mistake 2. The structure of his savings. $218,000 in a 401k. Is that a lot? For comparison, the average 401k balance according to Fidelity for the fourth quarter of 2025, $146,400. Mike was above average. But average is misleading. The median, the point where half are above and half below, is $34,400. A handful of accounts with millions pull the average up. The reality for half of America, $34,000. Mike with $218,000 in the top half. But that would last 7 to 8 years of withdrawals at $30,000 a year. And the average retirement length, 20 to 25 years. The shortfall, at least $300,000. That's where Walmart comes in. Mistake 3. He never used an HSA. HSA, Health Savings Account. The only vehicle in the tax code with triple tax advantage. Contributions are tax-free. Growth is tax-free. Withdrawals for medical expenses are tax-free. In 2026, the limit for a family is $8,750, plus $1,000 catch-up after 55. And new, after the One Big Beautiful Bill Act passed, bronze and catastrophic medical plans also give access to HSA starting January 1, 2026. Mike had access to an HSA through his employer for 20 years. Never opened one. If he had put $5,000 a year in for the last 15 years, accounting for market growth, his HSA could now be at $150,000 to $170,000. Dedicated money for medical care. Tax-free. No one told him. And the cost of health care in retirement for a couple, according to Fidelity, about $345,000. More than $350,000. like a house in Indianapolis. Except it's not a house, it's doctor visits and pills. Then something happened that upended his calculations again. April 2026. Mike's working at Walmart and learns about the earnings test. The rule: if you collect Social Security before full retirement age, for every $2 you earn above $24,480 a year, $1 is withheld from your benefits. Mike is already past full retirement age, so it doesn't apply to him. But his neighbor Roy started Social Security at 62 and works part-time. His earnings, $28,000. $3,520 above the limit. The result: they withheld about $1,750 from Roy's Social Security. But here's what matters. That money isn't lost. After reaching full retirement age, benefits are recalculated upward, accounting for what was withheld. It's not a penalty. It's a deferral. Who knows about this? Roy found out 8 months later.
On a forum.
May 2026. Karen found Mike in the garage. He was sitting in the empty RV, the one he bought in 2024 for traveling. Hadn't made it farther than the loop road yet. He said, "I worked my whole life, and it wasn't enough. Now here's a number that might make you want to sit down." According to Gallup and EBRI, the actual average retirement age in America is 62. Not 67. 62. Often not by choice. Layoffs, health, caring for family. But most people plan for 65 or 66. The gap between plan and reality, 3 to 4 years. 3 to 4 years without a salary that weren't budgeted for. And you know what the average American gets from Social Security? About $2,071 a month. Just under $25,000 a year. Try living on that in Austin, or Phoenix, or even San Antonio. And the maximum benefit at age 70, for those who earned the most and waited the longest, $5,181 a month. But that's the ceiling reached by a tiny percentage. So what to do? Not for Mike, he's 68, but for those who are 35, 40, 55, who still have time. For actions. Specific. With numbers. First, stop treating Social Security as your primary retirement income. The Congressional Budget Office in February 2026 published a projection. The OASI Trust Fund, which pays retirement benefits, could exhaust its reserves by 2032, 6 years from now. This isn't a collapse. It's an automatic reduction to the level of incoming taxes. According to CBO estimates, benefits would drop to 77%. 23 cents of every dollar would disappear. 77%. Not 100. According to the SSA Trustees Report for 2025, the date is a little later, 2033, the percentage, also about 77 for the OASI fund. Different sources, similar result. Congress could intervene. Historically, they have. But planning your retirement on maybe they'll fix it is like building a house without a foundation and hoping there are no earthquakes. Second, max out your 401k, but do it smartly. In 2026, the contribution limit is $24,500. If you're 50, an additional $8,000 on top. Total, $32,500. And if you're 60 to 63, a bonus from the Secure 2.0 Act. $11,250 on top instead of the standard $8,000. Not in addition, instead. Total, $35,750. Also, starting in 2026, if your previous year's salary exceeded $150,000, catch-up contributions must go into Roth format. Pay taxes now, pay nothing in retirement. 88% of employers offer matching, adding their own money to your contributions. That's free money. Not taking the match is like turning down part of your salary. Third, open an HSA. This week, $4,400 for an individual. $8,750 for a family. $1,000 catch-up after 55. Don't spend this money on small expenses now. Like if you learn something new, subscribe so you don't miss the next episode. In it, we'll break down the exact strategy. When to apply for Social Security to maximize your benefit. $5,181 a month. The ceiling for those turning 70 in 2026. how to get closer to it. Everything said in this video is educational content. This is not financial, tax, or investment advice. Before making any decisions, consult with a certified financial planner or tax advisor.